Our next story takes us to IU Health Arnett, where a new method of hip replacement surgery is being performed. News 18's Brittany Werner reports one recent patient says because of the new method, he was out of the hospital and on his feet in days instead of weeks.
65-year-old Larry Miller, born and raised in Lafayette, says before he had his left hip replaced, he was in excruciating pain for several years.
I just came to the doctor and he said that I had arthritis,
Due to his arthritis, doctors at IU Health Arnett suggested for Miller to undergo the new anterior hip replacement rather than the traditional method. Doctors say it usually means there's less pain, faster recovery time, and improved mobility.
So the procedure is actually a different approach to the hip replacement. We're still using the same implants that we do in a standard hip replacement, but instead of performing the surgery from the back or a posterior hip replacement, we're actually performing it in the front of the hip.
Dr. Orenstein estimates about 25% of doctors nationwide are now using this method. He says there's been 50 successful surgeries since they first started using the anterior approach in January. The surgery itself lasts about 60 to 90 minutes. Dr. Orenstein says many patients can get back to their normal functioning in just 2 to 4 weeks. 2 days after surgery, Miller was out of the hospital. He says he was thrilled to have the procedure performed right here in Lafayette, and even happier to get back to his daily activities.
I didn't want to go to Indianapolis to do that. I have no more pain anymore from the arthritis, and I get around very well.
And for that, he says he has a new surgical approach to thank. Reporting in Lafayette, Brittany Werner, News 18.